Dr. Toney Kiss Series, Iodine. Now, if you're watching this video, you're watching it probably because I told you to go on YouTube and watch this video to give you more information about how we test for iodine in this clinic. Iodine itself is related to a number of different problems in the body if we have a lack of iodine. Iodine is most often associated with the thyroid and the thyroid function. We could have thyroid malfunction as a result of low iodine. We can have an endocrine malfunction as a result of low iodine. And there are even some studies that have a strong correlation between breast cancer and a lack of iodine in the body. Iodine, testing-wise, how do we test it? We test it two primary ways. One way is a skin test. This test is not recognized medically. They will look at you like you have an eyeball on your forehead when you talk about the skin test. But what a skin patch test is when we put iodine on your skin, usually Lugol solution, and we put that on your skin, that should be on your skin for over 12 hours. Some sources say even longer. But if it is absorbed prior to 12 hours, that means your body is deficient in iodine and is sucking that iodine in through the dermis or the skin. You're low in iodine in that case. The other way, which is recognizable, is a urine test. We do a 24-hour urine collection. So basically we give you a fancy kit. You go collect your urine for 24 hours. You take a sample of that collection and you mail that into a laboratory that we use. That laboratory we use will then tell us if you are low in iodine or if you are toxic in the other halides, more specifically bromide, because bromide can go into the place where iodine would go, and therefore your iodine will never get to the cells as it's supposed to get to. There's a strong relationship between the endocrine function and the iodine status of the body. So we're talking sleep disturbances, we're talking energy-wise, we're talking weight loss, we're talking skin, condition of the skin, etc. There's a lot of things related to iodine. Those are the two ways we test. Iodine is very complicated. I want to give you a couple of books to read and refer you to. One book is called Iodine in Breast Cancer, Dr. David Deary. This is a very great book, great information. Some information will be like over your head. Don't worry about that stuff. Just read it as best you can. You'll get the basic knowledge of how iodine is related to breast cancer. And this is an MD as well. Another one is called, and this is one of my favorites, is called Iodine, Why You Need It and Why You Can't Live Without It. It's by Dr. David Brownstein, also an MD. Great information, very easy to understand. This one's related to iodine as well, so read those. Those are two books I would suggest that you read about iodine if you have any question about it. Kiss Series, Dr. Toney, Iodine. Have a great day.